All right, what's happening, Internet fam? I didn't want to do this, but I feel that I have to do this because the corporate media has got everybody so absolutely brainwashed and paranoid about their personal health. All of civilization has turned into Howard Hughes with his insane germ phobia. Everybody's going around wearing the face tampons. It's just absolutely nuts. So here's what I'm going to do. I live in Hawaii, and I'm going to give you all the stats from the governor. Now, these are the official stats from the governor of Hawaii. Whether you believe him or not, that's up to you. But I'm going to give you the official stats that the governor has given us here in Hawaii about COVID-19. And then I'm going to compare it with the data that we know about Hawaii altogether. So let's do that, shall we? That'll be fun. All right. March 31st, first COVID fatality, an older adult Oahu resident who was hospitalized with multiple medical issues is the first person in Hawaii diagnosed with COVID-19 to die. Older Oahu resident. How old? We don't know, but older. We can assume probably not 30s, 40s. April 2nd, an adult from Oahu is the second death reported associated with coronavirus. This one's interesting. This is the only one where they give you almost no data, and I've looked all over the internet and I cannot find data about this particular one. April 3rd, the third death from COVID-19 was an elderly adult Oahu resident who had been hospitalized in critical condition on life support for several weeks after traveling to Washington state. Again, we don't know exactly how old, but elderly, not somebody young, clearly. April 4th, fourth death is East Oahu adult, an East Oahu adult male over 65 years old, fourth person to die from COVID-19. April 6th, the governor said it was with a heavy heart that one of our Oahu neighbors passed away on Saturday. No details. We don't know. We have no idea anything about them. A Maui man over 65 years old is the fifth person in Hawaii to pass away from COVID-19. Department of Health is still investigating the circumstances behind the man's death, but it's believed he had underlying medical conditions. April 8th, the death of a Maui man who was 65 years old or older will not be counted in official DOH statistics until tomorrow, but is being investigated as the state's sixth death from COVID-19 and Maui's second. April 10th, the seventh death was an older adult woman from Honolulu who was medically frail and hospitalized. The eighth death was an elderly male hospitalized at Maui Memorial Medical Center in the chronic care unit. The total number of deaths now stands at 8. This is on April 10th. April 11th, a woman over 65 years old is the ninth death from COVID-19. She has underlying medical conditions and had tested positive for the virus when she was hospitalized on Oahu. So again, underlying medical conditions, but also tested positive for COVID. So did COVID actually kill her? Not clear to me. Could have been heart failure, pulmonary failure, Alzheimer's. So many different things could have killed her, but she might have also had COVID, but they're labeling it a COVID death. On April 19th, the state extends its condolences to the family and friends of the adult male visitor who is the 10th death in Hawaii associated with COVID-19. Again, associated with COVID-19. They're not saying he died of COVID. They're saying associated with COVID. So clearly he must have had other comorbidity besides just COVID. The individual was an adult male from Washington state in the 40 to 59 year age group. April 21st, the Hawaii Department of Health is reporting 2 additional coronavirus-related deaths last night. Deaths occurred on Oahu and Maui. Both are men 65 years old or older. On Oahu, the man had underlying health conditions and was hospitalized in late March. On Maui, the man who passed also had underlying health conditions. April 24th, Department of Health is reporting the 13th and 14th deaths associated with COVID-19 in the state. One is an Oahu man who had been hospitalized since the beginning of April, was over 65 years old, and had underlying medical conditions. The other is also an Oahu man over 65 years old who'd also been hospitalized recently and also had underlying health conditions. April 26th, the man who died earlier Sunday evening was from Oahu and was over 65 years old with underlying medical conditions. Health conditions, that they said in this quote. The 16th death is an Oahu woman over 65 years old with underlying health conditions who had been hospitalized since early April. May 4th, the state reported Hawaii's 17th coronavirus-related fatality Sunday. Health officials said the Maui woman was over the age of 60. She had other serious health issues and had been hospitalized at the Maui Memorial Medical Center since late February. Okay, so what we know is that 15 of the 17 deaths here in Hawaii were people well over the age of 50, most of them over 65, and almost all of them unilaterally had underlying health conditions. There were a couple where they don't give us data, so we don't know, but we can assume that either they also fell in that category or had some other comorbidity, but we actually don't know, and that is an issue. However, we know that 15 of the 17 who died here in Hawaii were over 65 and had underlying health conditions, or over 60 and had underlying health conditions. All right, so I've taken that data and I've put together a little graph here. The total population of Hawaii is 1.4 million, so that's here. And the number of deaths stands at 17, that's here, which means the morbidity here in Hawaii is 0.0012. So that is less than a third of the seasonal flu here in Hawaii. The deaths, confirmed cases, 621, recovered, 548. So the recovery report percent is at 88%, keeping in mind that there's another 9% that is still current, so we don't know. And the deaths of the confirmed cases were 2.74%. So if we just look at confirmed cases, the percentage seems quite high. Out of almost 3% of people have died. So 17 out of 621, that's almost 3% of the people have died from COVID. If you look at only the confirmed cases. But again, there's 1.4 million people in Hawaii, and there's probably hundreds of 100,000 at least that had been exposed to COVID and didn't get the disease and didn't die. So I think that the morbidity is probably closer to 0.0012 or 0.003, which has been the comorbidity or the morbidity rate that's been stated in many, many other locations throughout the world now, where we can get good data. Again, though, a lot of hospitals are over-reporting COVID. They had COVID and they had heart failure. They had COVID and they had pneumonia. They had COVID and they were dying of Alzheimer's or cancer or something. And so you've got to keep that in mind with all these stats. And so here we have, this is the chart for the COVID deaths for the whole population. So if you look at 1.4 million people and put that 17 people in there, you really can't see the slice of pie in that graph. So, and for that, everybody's walking around wearing a mask. You can't go to a restaurant. We have a 34% unemployment rate right now. So that's going to have some other effects for sure. Here's the death rate for confirmed cases. Now this looks a lot more serious, but again, we know that there's a lot more people who were exposed to COVID than got tested for it. So again, you kind of have to take this graph with a grain of salt. And again, even if you look at this graph, this is how many people have gotten COVID altogether, and that little tiny orange sliver there is how many people have died. So still, even with the confirmed cases, not a ton. This is the graph that shows you how many people are getting COVID per day or are being tested positive for COVID per day. And as you can see, everybody was talking about flattening the curve, right? But it seems pretty clear to me if you look at this graph here that the curve is pretty darn flat at this point. You know, we're over here. And even with, you know, unreported data, et cetera, it just doesn't seem like it's that bad. And again, this is the real story here. Everybody who's dying of COVID is old and has underlying issues. If you look at this graph, we can see that 15 people were elderly, older, over 60, over 65. And that there were 2 people, one was between 40 and 59. So again, could have been 59, 58, pushing 60. And one unknown, which also could have been somebody who was 70, 80, 90 years old. We don't know. But what this clearly shows to me is that this is not a risk to young people. This is not a risk to children. This is not a risk to people who need to go out and earn a living at their jobs, which has been made impossible by the governor here. Here's the confirmed cases by age group. This also backs up the data. You can see that very few people have even been confirmed in that younger age bracket, 0 to 19 years of age. In the 20 to 39 years of age, a lot of people have been confirmed who have had it, but very few required hospitalization. Only 3% of people under 40 had to be hospitalized for COVID. And that's pretty, I mean, That's who chose to be hospitalized. And again, did they have underlying medical conditions? Did they have were they obese? Were they a lifelong smoker? So much other data we don't know to consider to give this graph some more nuance. It's not provided. 19 people out of 200 and 18 people had to be hospitalized in the 40 to 59 years old category. And in the 60 plus category, this disease is dangerous for old people, just like the seasonal flu. A lot of people had to be hospitalized, and a few of them even died, just like the seasonal flu. This is the graph that I think really brings the whole thing home, though. This is the Hawaii COVID deaths by age graph. And again, this unknown marker down here at the bottom, we don't actually know what that person was. My guess is they were also over here on this side of the chart. I'm guessing nobody under 50 died of this disease. And we don't know again because this man was listed as between 40 and 59. This one's unknown. And this whole category was just elderly / older. So I'm guessing 70s, 80s, but we don't know. But a lot of them were listed as over 65 with underlying health conditions. So those are the graphs from the data that the governor has been giving us. So what you're not being told in these graphs and these data about COVID is all the knock-on effects of the lockdown. Right now, Hawaii is experiencing a 34% unemployment rate. So a third of the population here, more than a third of the population in Hawaii is unemployed. We know that those kind of unemployment stats lead to increased poverty, lead to increased other kind of illnesses, lack of health because of lack of quality of food. We also know that being locked in with your relatives leads to a higher incidences of domestic violence. There's been a lot of different kinds of crime here on the islands. There's actually not that much crime in Hawaii generally. However, right now the crime stats are all going up because 34% of the population is unemployed. And that's just now. How's this going to play out in 2-3 months, 4 or 5 months, when all these unemployed people suddenly are getting kicked out of their homes and living on the street? And sure, the lockdown may have ended by then, and maybe things will be, heading back to some kind of rationality. But the simple fact remains, very, very few people are dying of this disease. And yet, you can't go to the grocery store without wearing a face tampon. And I just have to ask if that's a reasonable response to something that is clearly as lethal or less lethal than the seasonal flu. And now we don't have to get into all the conspiracy theories about where this virus came from. The fact that Dr. Fauci paid a lab in China $3.7 million a few years ago, and that very same lab appears to be the place where this virus originated, and the fact that that lab was paid to study coronaviruses and trying to get them to transfer from animals to humans. So you can go so much farther down the rabbit hole with all of that discussion. But let's think about whether it's worth having a third of the population out of work and facing all of those socioeconomic crises. And that's not all. I mean, here in Hawaii, we've released a ton of prisoners out of jail. A lot of them violent criminals, and in fact, at least in one case I know, one of these people that got released from jail has already killed somebody. So the fact that we're releasing criminals out onto the street, we're putting everybody out of work, we're just, and the fact that the governor is still saying that you can't go to the beach, when we know that the one thing that coronavirus doesn't like is heat and sunlight. That's the one thing that kills coronavirus instantly, or COVID-19 in this case. And yet he's saying you can't go to the beach. And yet everybody's still shopping at Walmart. I mean, Walmart's hopping. People going through Walmart all the time. Grocery stores hopping. I mean, mind you, everybody's got their face mask on. People in their 20s, 30s, teenagers walking around with their face masks on. At literally a 0.000% chance of death from getting COVID. This is absurd, and it's all unconstitutional. The First Amendment says the right to peaceably assemble. It doesn't say with a mask. It doesn't say the right to peaceably assemble so long as there's not some crazy virus that Dr. Fauci paid for to have made in a lab in China. Okay, that's not confirmed. That's speculation. But certainly when you look at where the money came from, where it went, it's very curious, isn't it? It's at least a little suspicious. He certainly shouldn't be in charge of policy now, at the very least. So those are the stats on COVID-19 here in Hawaii. I invite you to look at the stats in your state. I invite you to also look at the stats internationally. And I also invite you to be very, very skeptical about the stats that you're getting, because a lot of these hospitals are being paid a ton of money to report COVID-19 deaths. They get paid even more if it's a COVID-19 death wherein they put somebody on a respirator. A lot of the times, putting a COVID-19 victim on a respirator guaranteed the hospital would get $30,000. One instance of putting a COVID victim on a respirator, $30,000. Now, tell me, if that was the deal at your work, would you be putting people on a respirator for $30K? Would you be like, let's put them on a respirator real quick? I mean, chances are you're not going to kill them. But what the heck? You're going to get 30 grand. That's worth a little discomfort for that patient for that moment. I'm not suggesting that's going on all the time, but it has to be going on sometimes, because otherwise, why would there be such a disparity in the numbers? Places like New York and Italy are reporting massive amounts of COVID death that just don't line up with the numbers anywhere else. Anywhere else. That doctor who did all that testing in California came up with 0.03. The Stanford study, 0.03. The USC study, 0.03. 0.03 or 0.039, so almost 0.04 in some places. That number is coming up all over the place for COVID morbidity rate. That's a very, very, very low rate of fatality for this virus. And yet we've completely eliminated our First Amendment rights, completely trashed the economy, put millions and millions of people internationally out of work. It shuttered tons of small family-owned businesses that will never come back. I mean, some of these small family-owned businesses are not going to come back from this. Several, I know, I've been reading on social media and heard from friends and everywhere else. A lot of these small family-owned businesses are going under and they're not coming back. So, was it worth it for a disease that looks to be having all the same numbers as a seasonal flu? And who was telling us that this was such a catastrophe, that we needed to completely alter our way of life and strip all civil rights and liberties from all Americans, and indeed from people all over the world? Who was telling us that? The CDC, the World Health Organization, Bill Gates, Dr. Fauci. Why would you ever believe any of them ever again? Why would you believe the corporate media that was re-trumpeting all of those states' stats constantly the entire time? Why would you believe any of them? Why would you believe CNN, MSNBC? They've all lied to you. The whole thing's been a giant lie, clearly. Look at the numbers. Look at the numbers in your community. Come up with significantly different graphs and numbers than I've come up with on my charts there. Do it. I mean, you owe it to the kids, you owe it to yourself, you owe it to the Constitution, you owe it to the livelihoods of millions of out-of-work Americans. You owe it to everybody to go and look at these stats and see if you can corroborate the official data. But again, I warn you to be very careful in thinking about what's labeled as COVID, whether it was a COVID comorbidity with something else, or an actual COVID death, or whether they had died of a heart attack and also had COVID, but the hospital gets an extra $8 grand for checking the COVID box, which means, boom, that death is treated as a COVID death, regardless of the fact that the poor deceased had, extreme heart disease, extreme lung disease, all kinds of other comorbidity factors. So just use your head, and for God's sakes, stop listening to the corporate media. And for God's sakes, if you're under 50, stop wearing a mask. You don't need to be wearing a mask. Unless you've got a serious health issue, this virus is no threat to you. Unless you have a serious comorbidity, diabetes, some kind of respiratory pulmonary disease, something serious, this disease is no risk to you. Stop wearing a mask. Stop social distancing. Stop not going to the beach. Stop not going outside. Stop not going to restaurants and bars. Do whatever you want. This is the United States of America. We have a First Amendment. It's the First Amendment. It's not the 7th Amendment or the 12th Amendment. The First Amendment says we can do whatever we want as long as we are organized peaceably. So unless it's an armed insurrection, You can go and assemble with as many people as you want, anywhere you want. This is the United States of America. Stop being slaves to the corporate media and stop being so scared because people on TV told you to be scared. They're always going to tell you to be scared. That's how they get ratings. It's all garbage. Stop watching corporate media. For the love of God, stop watching corporate media. All right, take it easy, Internet fam.